Record, there's a copy of the Open Meetings Act on the north wall of the chambers here. For health purposes, there's an automatic defibrillator in the back of the room. And also there is a copy of the Daily Record here with me. With that, we will have roll call.
Wade,
Here.
Festerson, McNally, Rogers,
Here.
Weiss, Jones, Wilkin, King, Espinoza.
With that, we'll go to item 2, approval of the minutes of the January meetings. Is there a motion to approve? A motion by Wise. Is there a second? Second by Wade. Roll call.
Wilkin,
Yes.
Wade,
Yes.
Rogers,
Yes.
Weiss, McNally.
We'll go to the action items, and we have items A through N. Is there a motion to approve? Motion by Wise. Is there a second?
Second.
Second by Wilkin. I just want to ask a few questions. So I'm assuming, Dr. Hughes, all of these amendments to the CDC piece, I saw the language from Community Alliance. I'm assuming the language is the same with everybody else? The CDC overdose data action amendments?
I think so. I don't have it in front of me right now, so I'm not
Okay.
sure which ones you're looking at. Do you have a spare agenda?
Vote. You guys know what that is. Just for some background of kind of how the food code structure works, or the FDA puts out their model food code, and then roughly 2 years later, Nebraska adopts that into legislation as the Nebraska Food Code. So how am I moving this, Heather? There we go. So the current Chapter 11 in the Omaha Municipal Code is severely outdated. It actually references the 1976 Public Health Service Food Service Sanitation Manual. So that's the last time this has been updated. We have luckily been able to regulate food establishments in Omaha and Douglas County with the current Nebraska Food Code and not this 1976 manual because of the Memorandum of Understanding with the Nebraska Department of Agriculture. This ordinance does predate the Memorandum of Understanding, which was started in about the 1980s. So back when this ordinance was last updated, we were, I believe, only regulating these food establishments on the Omaha Chapter 11 Municipal Code. So It contains articles for the regulation of different types of food establishments. So prior to the mid-90s, there was different food codes for every single different kind of establishment. So for meat markets, for soft drinks, for bakeries, each one had different regulations. And that still stands today in our ordinance. Since the mid-90s, the FDA combined all of those into a model food code, so they're all regulated on the same one. So also, there's a couple articles in our ordinance, like milk and frozen desserts, that we don't even regulate anymore. The state of Nebraska regulates those. So they've actually requested that we remove those from our city ordinance because it's conflicting with the actual current regulations. So in the proposed ordinance, some of the highlights of the things that we'll be doing is we'll adopt the Nebraska Food Code and the Nebraska Pure Food Act by reference. That way, every time the Nebraska Food Code or the Nebraska Pure Food Act changes, we don't have to make those changes in our ordinance. They'll just automatically go in. The difference between the Food Code and the Pure Food Act, the Pure Food Act adds a couple extra. The Nebraska Food Code is essentially the FDA Food Code, which is adopted. The Pure Food Act has some state-specific things in it, like fees and a few deviations from the FDA Food Code. The new ordinance will strike all of those different types of food establishments regulations and combine them all into one article of food establishments. It'll strike those articles that are no longer regulated by the Douglas County Health Department. It will update definitions and terminology to be consistent with the Nebraska Food Code. It will also prohibit bare hand contact with ready-to-eat foods. So if you're not aware, Nebraska is one of the last states in the nation to not adopt prohibiting bare hand contact with ready-to-eat foods. That was put into the FDA Food Code around 1997, and Nebraska has yet to adopt that. So actually, they are trying to adopt it in this new food code. LB 245 is going through state legislation right now to adopt the current FDA food code in the Nebraska food code. Prohibiting bare hand contact is in that, but in case that doesn't pass, we're putting it into the Omaha food code. It does seem like it will pass though, because there doesn't seem, it's a priority bill and there doesn't seem to be much opposition to it. So we are expecting for the prohibiting bare hand contact to go into the Nebraska food code also. It also require each food establishment to have a certified food protection manager. So that is a person in charge that has passed an ANSI accredited food safety training and passed an exam for food safety. That went into the FDA food code in 2013. Nebraska is only one of 9 states that have not adopted that for the entire state. Again, though, that is in LB 245 right now, so we do expect the state to adopt it. But if not, again, we want it in the Omaha food code. The last thing, and probably the biggest thing, is we are intending on requiring food handler certifications for all employees in Douglas County that work with food. This is the same requirement that Lincoln Lancaster County Health Department has had in Lincoln since about the 1980s, and they've successfully been able to implement this, and now it's just the standard in Lincoln Lancaster County. The training we're going to use is created through the University of Nebraska. It is Lincoln Lancaster Health Department's training, but we are going to alter it for Douglas County specific things. And then it, just so you know, it will be offered in English and Spanish. And one of the first things we intend to do with the revenue generated from this food safety certifications is create more languages for this training. Our timeline, we have been trying to get this ordinance updated for a better part of 10 years. We ran into some roadblocks. We got real close before COVID, and then obviously that put a pause on it. And then the 2 or 3 years that it got paused for COVID, you know, we had so many updates to make, we pretty much started over. We did, when we initially did this, completely rewrite the ordinance from front to back, completely struck the old one, tried to put in a new one. What we realized is that was a little too much to try to do at once. It's difficult to get something like that put through. We gave that initial proposal to the city attorneys in March of 2023. And then just at the beginning of this year, January 2nd, we realized, in December, we realized that maybe that was too much to try to push through. So We rewrote our proposal, putting only the priority items into it, and that was given to the city attorneys on January 2nd of this year. We're hoping to have everything ready for approval to the city council by March, because this does have budget implications, and we create our budget in March, so we hopefully will have it done by then. And then the plan is to have the new ordinance in effect January 1st, 2026. We have been doing stakeholder communication throughout this process. We've been in communication with the Omaha Restaurant Association from the beginning about the food handler training requirement and the certified food protection requirement. And for years, several years now, the Omaha Restaurant Association has been setting up a dedicated ServSafe food manager training with the Douglas County Extension Office to get their members ServSafe certified. So they've been on board with that for a while now. Just recently, we did form an ordinance change review board in collaboration with the Omaha Restaurant Association, so we can get feedback from the industry on the proposed ordinance change. Members of the board include owners and operators of Douglas County food establishments, the executive directors of the Nebraska Hospitality Association, and the Omaha Restaurant Association. There is a member of the Board of Health on that. Mr. Wade is on this review board. And then I have asked the president of a large local chain, food establishment chain that has restaurants in both Lancaster County and Douglas County, with the intention of being able to answer some questions for some of the Omaha food establishments that want to know how maybe this food safety certification affects their hiring ability, et cetera. I'm hoping that this person can answer those questions on how it's done in Lincoln, Lancaster County. So with that, I will take your questions.
Any questions?
Sure.
Back on one of the previous slides, you indicated that each food establishment was required to have a certified food safety, I don't know, what is the word, inspector?
Certified food protection manager, yes.
Okay, is that a full-time position, or do they just have to have one, like,
So what that means?
hired by them?
Yeah, so what that means is they don't have to, it's not just the sole role of that person. That person will be the person in charge of the establishment. They would already be there. There'd be a manager, there'd be a general manager. Taking that class makes them a certified food protection manager. So if they take the training and receive the certification, yeah, it's not a dedicated role.
Okay, thanks.
So along that question, do you know, because I haven't seen the food protection trainings side of it. I mean, ServSafe has been used in Douglas County and the state for forever for management. Do you know what the main differences would be between the ServSafe manager training and the food protection manager training?
So ServSafe is actually under the ANSI accredited classes for certified food protection managers. So ServSafe is certified food protection manager training. There's roughly, I think now, like 23 ANSI approved. ANSI is the American National Standards Institute. They have to certify these courses to meet food code to be a certified food protection manager. There's roughly 23 of them out there now.
So if you have your ServSafe certification, then that would qualify for
Yep.
the, okay.
Specifically the manager's training, because there's a couple different levels. So there's ServSafe food handlers,
Yeah.
and there's ServSafe managers, and the ServSafe managers qualifies as a certified food protection manager.
Question, just curiosity. Restaurants that require you to purchase bottled water and do not serve water, is that, I'm just curious. I guess restaurants have that prerogative, but I've been to 2 different restaurants and it's like, no, we don't serve water. You have to buy bottled water. I was just wondering, is that just, obviously the restaurant can decide to do that?
Yeah, that would be their prerogative to decide that. That wouldn't really have anything to do with food safety regulation or any permittings or anything like that.
Thanks.
So what's your timeline with negotiations with the, well, I wouldn't say negotiations, but whatever your communication is going on with all the stakeholders? What are you hoping to get it before the council in March?
Yeah, so with the review board, we've had 2 meetings. I've got one more survey out there to see when we can meet one more time, possibly 2 more times. So hopefully that's wrapped up here, I'd hope by the end of February.
Okay.
Yeah, beginning of March, end of February, hopefully we have that review board pretty much wrapped up.
So what was the come to Jesus moment after 10 years of trying to get it done? Is just the fact that you were a fairly new person and you wanted to get it off your plate, or was this
Yeah,
some Pearl Harbor that happened that we need to get it done?
Yeah, it became top priority of mine when I was hired as supervisor of food safety. And so just the will to get it pushed to where it needs to be is kind of what happened.
Okay. All right.
And great support from the administration, yeah.
Okay. Anybody else? All right. Appreciate it.
Yeah, thank you.
Let's go now to the director's report and legislative update with Dr. Hughes.
Good morning. Glad to see that everyone is here safely. Roads were a little crazy this morning. All right, updates for the department. Accreditation committee is set to review our submission during their quarterly meeting coming up here on the 27th of February. So we are extremely grateful to our accreditation site visit team who really kind of went above and beyond to get everything written and put together in time for us to actually get to be on the February review because we just had our site visit mid-February toward the end of January, toward the end of January. Typically, it takes about a month to put everything together after a site visit, and so they were able to get it done in about a week. So we're extremely grateful that they were able to do that so that we didn't have to wait an additional 3 months to wait on our decision. So the committee will meet on the 27th, and we should hear shortly after that, most likely sometime in the first week or 2 of March. So I am hoping that I will get to come to you at the next Board of Health meeting and announce that we have been fully accredited. So stay tuned for that. In terms of our strategic plan, February 27th is actually going to be a pretty important day for us. Not only is our accreditation packet being officially reviewed, but we also will be holding our final action planning, strategic planning meeting on the 27th. So this is kind of that last step just to get any action items that we want to be in the actual document put in. And then we will have an actual strategic plan report that's complete and finished. So I will also get to present that to you in March. So March should be a big month for us. The release of the community health assessment data is going on, I believe, this week. There should be a press release that is going out regarding that. So I will assure that we get either PRC or myself on the agenda to also present that data to you. And then just as an addition to that, we have taken kind of the top issues that have been identified through that document, and then we are doing a deeper dive into the data to make sure that we really are able to effectively target anyone who is needing additional services, additional support, whatever gaps might be there. We want to make sure that we are adequately identifying those so that we can be as efficient as possible in addressing that. So not only will there be, the regular release that everybody gets, that is being discussed in the community with the community conversations and things like that, but I will also be bringing you some more in-depth data once that review is finished. So it's been kind of a anxious month, I guess I could say, for the health department with a variety of different changes that have occurred at the federal level. We definitely have felt, I think, the brunt of quite a bit of that. As you are well aware, there were a couple of things that happened early on in the administration change namely a communications freeze from all federal health agencies, and then there was also a funding freeze on all federal grants. As you can imagine, that created quite a bit of anxiety. We did have a lot of conversations with our staff. It did spur us to do quite a bit of planning and looking at budgets and how we communicate and things like that to make sure that we are still able to do what we need to do to serve the population here in Douglas County. I am happy to say that the communication freeze, though challenging, we are now starting to hear from our federal partners again, which is wonderful news. I did check to see if things had been reinstated onto CDC website. It does look like most of that is there, which is wonderful news. The MMWR, which is a very important publication that public health uses to really monitor things that are happening in the country. It presents great case studies of different interventions that have been instated in different jurisdictions and how those have worked out. So it's a very good data source for us, and it does appear that that is back in publication, so I'm very relieved to see that. Our funding at this time appears to all be okay. So we did, I'm very grateful for my senior leadership staff who immediately were reaching out to project officers and really trying to get their arms around what that funding freeze meant. Very happy to report that at this time we are able to continue to spend our federal funds the way that they had been given to us. The work plans that we had submitted in order to get those funds are all still the way they were before. There haven't been any changes requested to those. So I am very happy to just report that for now, things are moving as they should be, I suppose, here at the local level. Although there continue to be other things happening that we have to keep our eyes on. So for instance, today there was an executive order bringing the EPA and other independent regulatory agencies under the purview of the executive branch. So I don't think it's been heavily picked up in the media just yet. I think it's pretty early since it just happened. But it does appear that any of those independent agencies that do have a large role in regulations will be now subject to sending all of those regulations through the White House. So that is something that just happened. I don't obviously know all of the details on that, but it's something that certainly we're keeping our eye on. And one of the things that had come up pretty early on with the changes was around some changes around DEI. And that is something that I wanted to go on record as saying that, we continue to serve every single person in Douglas County, regardless of who they are. And we remain firmly committed to that. When we say healthy, vibrant, everyone, everywhere, we put emphasis on the everyone. We want to make sure that our community knows that we are still here for them. That is all I have for our department updates. Any questions?
Dr. Hughes, I'm just curious, the data piece, has that caused you all any hiccups with that data shortage and the communication down? And I say that in the context of this, in regards to the bird flu concerns and data and the measles in Texas.
Right.
Where is the department at in regards to that data preparation? How we laying the groundwork? What's the talk out there about where this is coming? And, how do we start getting in line with
That's a really good question. And yeah, the answer is yes, that created a lot of anxiety because obviously without having data about what's happening around the nation, whether that's bird flu, measles, norovirus, pick something. We essentially don't have the ability to know, at least through those normal channels that we would use. So, you know, we weren't getting CDC reports, obviously, on what was happening throughout the nation. I will say that public health is incredibly creative, and so we were able to kind of look for other sources to continue to at least wrap our heads around what was happening around the nation. Internationally, you know, the fact that we are no longer part of the World Health Organization, you know, it just means that we have to get our data maybe in different ways or get our information in different ways and make sure that we're paying attention to maybe alternative sources of that information. I will say that nationally, public health professionals really jumped in and assured that they were sharing data. So even if CDC wasn't, other jurisdictions or other agencies were sharing information publicly. There were a number of organizations, I guess, that you know had already downloaded certain data sets from the CDC or other places that were restricted that they were able to then share with public health if necessary. So there were kind of some ad hoc data and information sharing efforts that happened nationally, which was helpful. But of course, the thing about having access through the CDC is that that is standardized data that everybody is using. They're all using it. It's you know, pretty much the same in how that information is gathered and disseminated. And so you do lose some of that standardization. In terms of what's happening here in Nebraska, there was no change to how information was shared from the state level. So we still maintained that. So we were very much able to know what was happening here in Nebraska. So from that perspective, you know, things didn't really change. It was really the federal changes that created a lot of questioning, a lot of just anxiety is the best word that I can use around how we were going to get information, how we were going to get data, how we were going to know what's happening. You know, there were times early on where we were hearing about, you know, our epidemiologists were hearing about things at the same time everybody was hearing about things through, you know, the Washington Post or whoever news agency. So definitely not ideal, definitely not the way you would want to be getting data, especially when you're having to just kind of go out and see what you can find instead of knowing where you can go right away when you have questions or when something's happening to gather that data. So it definitely did create hiccups for us. There was a lot of time spent internally trying to figure out, okay, what do we do next? You know, where are we going to get data? How are we going to know what's going on? How, you know, and so it's unfortunate that that had to take a lot of focus away from the work that we would be doing day to day, especially in the middle of, you know, influenza, knowing that we've had flocks with bird flu nearby. You know, it's just really unfortunate that we had to spend so much time in reaction to what was happening rather than actually doing the work of protecting people.
So I'm gonna give you a scenario that I need you all to plan for, and this is a legal question too. And so, not really a question, but this is what I need you all to work on. So I've been running through my head the possibilities and some of these constraints that we're on. So if the state hasn't had any communication, well, this is my scenario. So, you know, there's FEMA jobs getting cut, and you play this role there. And I'm wondering what your conversations are with Whitney. And then, based on the other cuts that are coming, if you plan for what may happen at the state if that happens.
Mm-hmm.
So this is the scenario that I need you all to do for me, and I need it like, I need everybody to take it seriously.
Mm-hmm.
I need you all to give me a number that would need to be matched if, for instance, if we're out here on an island and the federal government can't respond to bird flu or measles, and the state can't respond to it enough. I think us and Lancaster are the only ones that have any local money, and I need you all to give me a rough scenario and just continue to flesh it out about options of where to go, because what I don't want to do is be flat-footed.
Yep.
And so give me the options about the money, what it would take to cover, and then legally, I need you all to run through how fast could a special election happen to ask for a voter override of the levy, or to even get it to pass. And then I need to know what the options are of being able to do that by mail, because technically we can't. So, I mean, I need like a full-blown scenario to start putting this on radar screens. And just continue to flush this out, because, and I don't take this lightly, I see this scenario. And so.
So do we, and
Okay.
we have already been looking at that, really trying to see what it takes to, at least at this time, the federal funding was the big issue. So we were looking at how do we move people off of federal grants into other pots so that we can, assure that we have our workforce, because I'll tell you, they are absolutely our biggest asset. I don't know that Douglas County understands truly what these people do for them every day. They are incredible people, incredible humans, and to a person, they are passionate about what they do. And it's not because they get huge paychecks, because we know that's not the case. It's because they love their community. And so they are my priority when it comes to protecting the public's health. They're the ones who are doing who are looking out for that. So protecting that infrastructure is going to always be my first priority. So we've already started looking at things that we would need to do, what the shortfalls would be. So I've got a lot of that work already done. I can put some finishing touches and probably have it to you by the end of this week.
Okay. And I'm saying this intently at this meeting, so press and anybody on Zoom can hear. I have a grave concern, and I'm willing to talk about it, about the preparedness and how this is going to trickle down with NIH staff cuts, research cut, state cut, and the nimbleness just to be able to move.
Yeah.
And so that's why it's happened before.
I share that
And-
concern with you, and I will say that when we very first heard of federal cuts occurring or the freeze with the grants, I actually had a conversation with Whitney, and so she and I have already talked about what that could mean for our county, and I think that between she and I, we have a pretty strong commitment to assuring that we protect that infrastructure, especially given that we do have assets in our community that, we've got special pathogen assets in our community, and that really could mean that, if we don't have a strong preparedness infrastructure, people may not be as well protected as they need to be. And so 100% share that concern with you. Whitney and I have already started talking about that as well over the last month.
Yeah, because my next concern on that is we've had a fairly light winter, but my scenario that I keep seeing is you have a good flash flood, and it rushes like it did in Douglas County, in western Douglas County. You had the issue with that tornado last year. I can see another one of those.
Yep.
I can see the issue that happened downtown. I can see that windstorm that happened just 2 years ago. And so with FEMA and everything, the state cutting is going to fall local.
Right.
And so I just, the flags need to start going up, and people need to be hearing that this can affect that. And so I don't want to get caught behind on it.
Yeah, I agree with you, and we can talk more about the state
Yep.
issues
Okay.
when I hit the legislative report.
Okay. Morning.
What's Whitney's title again?
Whitney is the Director of Emergency Management for the county.
Right.
Sorry, yeah, I need to explain that, sorry.
Yep.
Any other questions? All right, are you done?
Legislative report.
Okay, all right. Thank you all. Let me ask, are there any questions from anybody on any of the,
Chris,
Oh.
sorry, did you want me to do the legislative report
I thought-
for
yes,
the
no, I thought
state?
you were doing them all in one. Go ahead.
Not a problem. Okay, so as you also know, the 2025 Nebraska legislative session is well underway. There is a comprehensive bill tracker on the Board of Health intranet site, so please feel free to check that out at your leisure. It was last updated on the 11th, and I will update it again today. But just to give you an idea of what's out there and what we're tracking, so we have a few, and when I say we, I'm speaking mostly about prioritization that's been done by all of the local health directors across Nebraska. We agree that we are better together than separate. However, there are times that separate health departments will take on an effort to educate on something that maybe the rest of us aren't doing as much effort around. But for the most part, we are united on what we're paying attention to. So our priority bills for NALED this year are LB 22, which is the Nebraska Evidence-Based Nurse Home Visiting Services Act. This bill essentially mandates that evidence-based nurse home visiting services are available for postpartum mothers of children in Medicaid and CHIP. This is something obviously that we would support. Right now, it is on select file, so it has advanced to that point.
What number is that again?
LB 22.
Okay.
The next one is LB 621, which is the Nebraska Healthcare Cash Fund Sustainability Act. And this one amends the Healthcare Cash Fund to ensure that it is sustainable for healthcare programs and community health centers across Nebraska. This is one that we are right now just watching. And it has its hearing on March 17th, so no major action for a little bit on that one. LB 203 is the Public Health and Welfare Legislative Bill. And this bill amends some existing public health statutes in Nebraska to redefine terms and adjust powers. So this one, if you remember last year, Senator Kauth had put together some legislation that impacted how direct health measures are issued essentially in local jurisdictions. So this would essentially require, it would require if a health director wanted to issue a DHM because of like a pandemic, something like that, that they would need to go through their local board to do so. This one we're just watching right now. She has made quite a few changes since last year's version of the bill to this year's version. It mostly, or I should say most heavily, would impact Lincoln-Lancaster County Health Department. So they are opposing it. NALED at this point is just watching it to see kind of where that goes. And they did have a hearing on February 7th, but it hasn't gone any further than that.
My interpretation, would that strengthen us? Because basically, it's right now, the part of the law we fall into, we don't have that. And I'm
Right.
wondering, would that supersede that ordinance passed by the city and basically give the Board of Health power to do it?
That's a good question, and it depends on who you talk to. So there is a fair amount of confusion in this particular bill in the language, which is one of the reasons we're kind of just watching it right now. It depends. I did reach out and have Elizabeth look this one over for me, and it does seem like it would essentially put that DHM power back in the hands of local boards. But if you talk to DHHS, they would tell you, I think that no, for a county DHM, you still would have to go through the state. So there's some confusion there, and obviously we have different jurisdictions that are interpreting the language in that bill in different ways. So I can't answer that question for you because I don't think anybody knows right now.
Yeah, local boards having to go to the state don't add up.
Right.
Okay.
The city ordinance, obviously, that pertains to the city health director powers, and so that would be the same as it is now. It would not,
But I interpret
this bill would not supersede our code.
Yeah, I keep thinking if the state was to pass that, those state statute would trump city ordinance.
Right.
Okay.
Okay. LB 104 is the Family Home Visitation Act, and this establishes family home visitation to support programs for home visitation for anybody. And that is one that we are supporting. And that bill had a hearing on February 7th as well, but no further action at this time. And then the big one that I wanted to make you aware of is LB 261, which is the governor's appropriations bill. And in this bill, they propose a $4.5 million reduction in state aid to local health departments. We're not sure if that actually went through as written. We're not sure what the distribution of that cut would look like, whether it would be an equal cut to all jurisdictions or if it would be a per capita reduction. However, we get about $1.9 million that would be impacted. So that is quite an impact, as you can imagine. That $1.9 million touches a number of our programs, including preparedness. It also supports our STI and immunization clinics, along with a number of other, there are just a number of people under that funding and programs that we support with that. So it would be quite a large impact to us if that happened. It's pretty concerning because Nebraska is already vastly underfunded when it comes to per capita investments. Right now, I believe that we are sitting at about $5.99 per capita for public health investments here in Nebraska. The average is around, from the nation, is about $15 per capita. So we're already lagging. This cut, if it went through, would take us down to about $2.11 per capita in Nebraska for public health infrastructure support. So clearly that is quite a reduction. It would be a huge impact, not just to Douglas County, but to really the entire state. Here in Douglas County, we're also vastly underfunded. We would need to generate about an extra $15 million and hire about 114 people just to be on parity with communities who have populations of similar size to us. So we're already underfunded. So this clearly would be a move definitely in the wrong direction for us and would have a negative impact, not just on the health department, but really that means an impact on the people who live here, who get to benefit from the protections that we are able to provide, and that's all of us. So obviously we are opposing that, and quite a few activities going around the state regarding just educating senators regarding the impact of this bill, should it, or of this part of the bill at least, should it go through as written. I personally have already met with several senators, 2 of them on the Appropriations Committee, just to make sure they are well informed of what the impact would be, educating them on what we do. I have another meeting coming up in a couple of weeks with another one who's on the Appropriations Committee. And then just really, educating the public on what a cut like this would mean. We did, and you approved in the consent agenda today, put together a resolution and a letter in opposition from the board to go to the Appropriations Committee. So thank you for that. I will make sure that gets uploaded so that they have that. And it's not only us, all of the other health directors, again, also speaking to senators, educating their community partners, the people in their communities, really on what a cut like this would mean. There's a bit of a misperception out there that this funding was COVID money, and it absolutely was not COVID money. It happened to come to us when COVID was happening, so it looked like it was COVID money. But this money really was an effort by the local health directors to start getting Nebraska's per capita spending on public health closer to what the average is for the nation. And so that's really what this funding represents. It was not COVID funding. This was just trying to get us closer to parity with the rest of the country. So those are our priority bills that we are watching right now. And the hearing for that, I should mention, the hearings for the appropriations bill started yesterday, but the HHS portion won't be heard until March 10th. So we'll continue to educate and hopefully help people to understand what the impact of that would be before then.
Questions? Okay. Let me ask let me ask the questions while you're up there on this, and we'll bleed into the reports. What's been your all's response from the releases that were sent out about the late notices? Because today is the day, right?
Say that again.
What's been your response into late license permits? Because today is the day, right?
Oh, yes.
Okay.
Yes. So we will be closing restaurants down if they haven't come in to pay their permit fees. And that list, I think, went out last week on Friday. And then the effort to actually start closing people down will be this afternoon. That will start this afternoon.
So what do they have till today at 4:30 to get it in, or was that, they're already late?
They're
so I
just,
mean,
honestly, probably they have until noon. And then they would avoid that. So of course, obviously there's their regular fee. Now there's a late fee.
Mm-hmm.
If they get closed down, they have to also pay a reopening fee. So we would love to save people some money and get them to come in and get that taken care of as soon as possible. Because after 12, I can't guarantee who gets visited when for that effort.
There was like one group of a whole bunch of names. I assume maybe it's one owner of all those restaurants. Do we like put priority on those first, since you can? Priority is put on repeat offenders. Oh, okay. So that's how it goes.
Priority is on repeat offenders. So we do have, we basically give one mulligan. So this is the policy. The permit invoices go out the end of November. They're supposed to be paid by the end of December.
Mm-hmm.
And then there's kind of this like grace period until mid-February before we start closing people down.
Mm-hmm.
In that time, there are multiple phone calls, emails, letters, that sort of thing, reminding people and trying to get them in to get those. So this should not be a surprise. This is also an annual expense that happens every single year. So our restaurant owners know that this is, part of their operating costs and would be in any community. And so it's not anything new. We do understand that things happen. There can be some pretty serious major life events. So we do have, we have a one mulligan rule. So you get one, okay, I won't close you down or I won't charge you a late fee, depending on when you come in. And then after that, you're in the boat with everybody else. So oftentimes, especially with people who this is kind of the trend every single year, they're not going to have any options. They really need to get that paid. Yeah.
So I saw at least 3.
Mm-hmm.
So I'm probably with some for that. And the 3 I saw just has been within the last month. So, okay, so people have had notice.
Oh, much notice.
So can you send the board at noon that list of whoever's final having paid,
Yeah.
just so we know? Okay,
Can do that.
all right. Anybody else?
Just a quick question in terms of logistics. Adam, how does that work then? At noon, do you physically go to the establishment and?
Yes, myself and one other person. I have an interpreter with me who's also a member of the food safety team. Will go to the establishment and give them the information of why they're being closed down, what they need to do as far as payment to get opened back up. And they're given a handout with all that information on it. So it's very clear what they need to do to get opened back up as soon as possible.
I have a question. How long does that process take for them to get reopened? Do you have an idea about that?
Typically, it's the next day that they're able to get reopened.
Okay, perfect. Thank you.
Okay. So any other questions from the reports from anybody? Okay. With that, we will need a brief exec session on personnel. And so with that, I'd like to ask for a motion to go into exec session. And when we come out, there's not going to be any business, so we'll just reconvene and adjourn. So anybody that doesn't need to be here can go. And so with that, is there a motion to go into exec session for personnel reasons? Motion by Wise, is there a second? Second by Jones. Roll call.
Reese? Yes. McNally? Jones? King?
Yes.
Rogers?
Yes.
Wilkin?
Yes.
Wade?
Yes.
Okay. So
Chris?
now we can go back in the room.
Just,
Yep.
it appears we have some guests sitting in the back. I'm guessing that I might know who you are, but would you mind telling us why you're here today?
You got to come up. 'cause we
Just,
can't hear
I heard Creighton. Just, yeah.
you. No, you got
That's
to go
fine.
into.
Okay. Good morning, everyone. Hi, my name is Cassidy, and that's Alyssa and Caroline and Wendy. We're students at Creighton in nursing school, and we are in a professional concepts class, just learning a little bit about public health. And so we were invited to come to a public health meeting, and so here we are learning today. So
Okay.
thanks for welcoming us.
Great, thanks. Appreciate it.
Okay, with that, the room's done there, so we can go in the back room. And Heather, we should be quick to come back.
Chris, you got a couple of minutes to talk to Julie?